Welcome to The Explainer. Today, we're digging into something we've all experienced, a toothache, and exploring how something so common can, if you're not careful, turn into a serious medical emergency. Come on, be honest. Who hasn't? You feel a little twinge, maybe some sensitivity to cold, and you think, it'll go away. I'll deal with it later. It's just so easy to ignore. But what if later is too late? What if that tiny problem isn't staying put? Deep inside your tooth, an infection could be packing its bags, getting ready to go on a very dangerous journey. So that's what we're going to do. We're going to follow the path of that infection. We'll use your body's own anatomy as a kind of roadmap to see just how a simple cavity can escalate into a true life-threatening situation. All right, first things first. We need to know what we're actually talking about. The official medical term for this is an odontogenic infection. It sounds complicated, but the meaning is actually really simple. Odontogenic just means it starts in or around a tooth. That's the key. Its entire origin story begins right there, in the tissues of your jaw and gums that hold your teeth in place. And how does it kick off? Well, it usually starts with really familiar problems. We're talking about deep cavities, serious gum disease, or maybe a tooth that gets cracked or broken. Any one of these can become a perfect gateway for bacteria to get in and set up shop. Now, an infection has one goal: to grow and spread. It doesn't want to stay locked up in one tooth. So the big question is, how does it get out? How does a local problem escape and start wreaking havoc everywhere else? It turns out there are 4 main escape routes. It can just push its way directly into the tissue right next door. It can hitch a ride in your lymphatic system, or even sneak into your bloodstream. But the one we're really going to focus on, the most dangerous one, is when it travels through what are called fascial spaces. The best way to think about these fascial spaces is as hidden highways. They're these potential pathways that run between the muscles and tissues of your head and neck. And for an infection, they are wide open roads leading to some really critical areas. And what's so fascinating is how your own anatomy basically dictates the infection's travel plans. For instance, if you have an infection in a lower molar, it tends to travel down into the submandibular space, which causes that classic swelling right under your jaw. An infection in an upper molar, that can climb right up into your maxillary sinus, feeling like the worst sinus infection of your life. And a problem in your lower front teeth can cause swelling in the sublingual space, right under your tongue. So if all this is happening inside, how would you even know? Well, your body is actually pretty amazing at sending out alarms. The trick is knowing what you're listening for. This is the crucial question, right? You have to be able to recognize the moment the problem stops being just a toothache and starts becoming something much more serious. There are very specific red flags to watch out for. Okay, when things get serious, the signs are pretty unmistakable. And I'm not talking about a little puffiness. I mean significant, visible swelling in your face or your neck. Pain that is severe and just won't quit. And then you have the full body signs like fever, chills, just feeling awful. 2 of the biggest alarms are difficulty swallowing or finding it hard to open your mouth. That's your body screaming that the infection has left the building. Now we need to talk about the rare but most severe outcomes. This is what can happen if those alarms are ignored and the infection crosses a critical red line. One of the most feared complications is something called cavernous sinus thrombosis. This is when an infection, usually from an upper tooth, takes those hidden highways straight back into the sinuses of the brain. There, it can form a blood clot that is incredibly dangerous. The symptoms here are absolutely terrifying. We're talking a severe, crushing headache on one side. One of your eyes might actually start to bulge out. You could have double vision, and there's even a risk of losing your sight. This is a 5-alarm medical emergency. And as if that wasn't scary enough, there's another really severe outcome we need to cover: an infection that moves with unbelievable speed and causes incredible destruction. It's called necrotizing fasciitis. You've probably heard of it as a flesh-eating infection, and it is just as bad as it sounds. It's an extremely aggressive bacterial infection that just obliterates the soft tissue and the fascial highways it travels on. Its signature moves are speed and devastation. The pain is extreme and it comes on incredibly fast. The tissue death is widespread. The only way to stop it is with immediate aggressive surgery to literally cut away all the infected and dead tissue. Okay, after all of that doom and gloom, here's the good news. Doctors have a very clear, very effective playbook for fighting these infections. So let's look at how they turn the tide. The treatment really boils down to 3 essential pillars. You have to do all 3. Number 1, source control. That means getting the infected tooth out of there. Stop the problem at its source. 2, surgical drainage. If there's an abscess, a collection of pus, it has to be surgically opened up and drained out. And 3, powerful antibiotic therapy to hunt down and kill every last bit of the bacteria. So let's zoom in on that 3rd pillar for a second. The antibiotics. What kind of medication are we actually talking about here? Well, the typical first choice is usually a penicillin-based drug like amoxicillin. If you're allergic to penicillin, don't worry. The go-to alternative is clindamycin, which works really well against the kinds of bacteria we see in these infections. And for the really complex, gnarly cases, doctors might even use a combination of drugs to make sure they've got all their bases covered. And all of this brings us to the single most important takeaway from this entire explainer. It really is this simple. Early intervention is absolutely key to preventing complications. The faster you act, the simpler the fix, and the better the outcome. Period. So the next time you feel that little ache, that throb, or you see a bit of swelling, I want you to remember those hidden highways inside your head and neck. Your body is sending you a signal. It's talking to you. The only question is, are you listening?